I developed antibodies. I've tested positive for antibodies, but my husband and daughter have not. But they were much less sick than I was. It may well be they've got T-cell immunity. Why are we not looking at that?
So T-cell immunity is very, very important. The whole of the immune system obviously works in tandem. It's actually very complex,
Yeah.
but the so-called humoral immunity or antibodies is an important part of that. And we know, actually, we did some tests within our own study because the lateral flow device gives you a qualitative answer, yes, no, do you test positive for antibodies? And at the level that it tests positive, it correlates with neutralizing antibodies, which are the ones that protect you from the virus getting into cells.
Yeah.
So it is a complex picture. T-cell immunity is important, but to be honest, the sort of whole immune response tends to correlate also with antibody levels. So we do need to know a lot more about how the T-cell immunity works in tandem with this virus. It's a new virus, so we need to understand.
Well, it's a new virus, but it's coronaviruses have been around for a very long time. It's a new version, effectively, of a virus we're fairly familiar with. So, and we know how they work, don't we? I mean, and we're not all. I mean, we're not all dying of SARS or MERS or swine flu and the like of things. We clearly, we don't have a vaccine for most of those. So how is it that we're not all dying from them if we haven't got some level of immunity?
SARS and MERS were very dangerous viruses, and they did have a high mortality rate.
That's irrelevant. What's the point? We're not all dead, though, are we?
You're mentioning those viruses, so let's just focus on the virus in hand that causes
No.
COVID.
No. It's relevant. My point is, you're saying we don't have a vaccine for those. People probably don't have antibodies for those viruses, and yet we're not all dead from those viruses. Those viruses went round the world, and we didn't see hundreds and hundreds of thousands or millions and millions of deaths. Why not?
People did die from those viruses.
I didn't say people didn't die from those viruses.
It was contained more. It didn't go around the world in the way that
it did go round the world. Not as much as this, but we didn't see millions and millions of deaths.
So here we have a pandemic of a novel virus, which is a dangerous virus, and it's causing,
like SARS and MERS, yes,
and which is causing a lot of people to go into hospital and a lot of people to die.
Could you address the point I asked you, with all due respect?
Sorry, what is the point?
The point is, how can we not have developed some sort of immunity? We developed immunity to other coronaviruses, clearly. Otherwise, we'd all be dead now.
Well, the coronaviruses cause a common cold. We have immunity, but we recatch the common cold, so we have transient immunity. What we're showing in our study is that the antibody levels to the first wave of the epidemic have dropped in the population.
But I understand that. I'm asking you about T-cells.
So the amount of immunity from antibodies, that component of immunity has dropped. And the only way we're going to protect the whole population is very simple, two measures. One is to use the public health measures, which are really, really important while we wait for a vaccine. And that means that we have to pay attention to the message about social distancing, extremely important. Hand washing and face covers where needed. Yep. And that's how we're going to deal with this over the next period.
You just have no intention of answering my questions then, do you?
Sorry?
I mean, I'm Professor, with what you intend, I'm asking you a really simple question. I mean, Professor, I'm not an expert. You're an expert, but I don't pretend to be an expert. But Professor Sunitra Gupta, a professor at Oxford University, an epidemiologist with expertise in immunology, vaccine development, and mathematical modelling of infectious diseases. She, along with Carl Hennigan, professor of evidence-based medicine at Oxford University, and many others, saying, well, it can't just be antibodies. There's T-cell immunity. This is widely accepted among experts in your field.
Yes.
Why is it not possible that a lot of people in this country and around the world have actually already developed some level of immunity through T-cells, not just antibodies?
Julia, can I spell it out in words of one syllable? There is T-cell immunity, but we are in the middle of a pandemic. And at the moment, so we're doing another study called REACT-1, which is looking at the spread of the virus in the population. Yeah. The virus is spreading everywhere in this country. It's going up. And despite whatever immunity levels there might be, the facts are that the virus the R value is still above 1, and the virus is continuing to spread at an alarming rate through the population, not only in young people, but right across the age range to the vulnerable people at older ages. So just looking at the facts, we are not being protected from this virus.
Well, apart from the fact that we're not all dying at the same rate, can you explain Sweden then? What's happening in Sweden?
So what's happening in Sweden is that the infection rate is going up.
How many deaths are they having per day?
I'm afraid I
can
can't
tell you the figure. It's 2. 2 people
Well,
a day. A population of 10 million and 2 people a day die.
I don't particularly want to comment on Sweden. I'm going to comment on what's happening
no, but it is
in
relevant.
England.
How on earth are people, given that
England,
we've not got these lockdown and tier measures and all the things that are suggested by SAGE and others in Sweden, and they're living largely free lives, not wearing masks, social distancing, yes, some people working from home, but going to bars and restaurants, living their lives relatively freely, and yet 2 people a day are dying. Yes, it's going up slightly because, of course, it's autumn. We know this is a respiratory illness. How do you explain that in the context of we can all possibly die from this virus because we haven't got antibodies?
So the situation in Sweden is different. The population density is different. The culture is different. In the UK, in England, which is what we're measuring, the rates are going up. More people are going to hospital, and more people are dying.
Yes.
And if they continue to go up, yet more people go into hospital, and yet more people die. What we have to do is control this virus. We have to turn the R value down, and we have to. And the fact of, are we all immune? No, we're not all immune.
No one said we were all immune. No one said that.
Because we can see that the virus is continuing to rise, and we have to do something to address that. What we can do is public health measures until we get a vaccine.
I just find it absolutely extraordinary that someone as eminent and knowledgeable about this as you refuses to accept that your explanation does not explain why in Sweden people can live a normal life and only 2 people a day are dying from this virus. If what you are saying is the case, and people do not have any T-cell immunity, and there's no way of creating herd immunity in this sort of way, then they would be there'll be body bags all over the streets of Stockholm, and there aren't.
So the rates of infection in Sweden are higher than amongst their Scandinavian neighbours. So Sweden is a very interesting case. They've taken a slightly different route, but at the end of the day, they do socially distance. They are taking care. And Sweden is have their own issues to deal with. In England and in the UK, I come back to the fact that the rates of the virus are continuing to increase.
We know that. They do that every autumn. It's respiratory disease, and every respiratory disease, the death rates and the infection rates go up every autumn. Professor Paul Elliott, I know you've got no intention of answering my direct question, but I'll give up. Right now, let's talk about the whole latest on these coronavirus figures with Professor Anthony Brookes, who's a geneticist and health data scientist at the University of Leicester. Good morning to you.
Good morning, Julia.
Good morning. I mean, focusing so much in recent weeks on the economic effects of lockdowns and Tier 3 measures and the battles between these sort of Labour mayors and Tory government, and indeed now Tory backbench MPs. But actually, focus has really turned back to the medical side of things with these latest figures and some tests, some major research results out in the last couple of days. Let's take them all in hand. First of all, let's talk about the UK death toll. It's now up to just under 60,000, 59,927 deaths with COVID. It must be very clear it's with, not of, UK-wide data. We're looking at a death toll yesterday that was reported, 367. Now, we know the Tuesday death toll always much higher than other days because it takes into account a lot of those weekend deaths that mean lower death tolls reported on those days. But this is a concern. There's no doubt at all we are seeing infections on the rise. What do you make of those figures?
Right. So first of all, there is no doubt that the virus is spreading further in the last many weeks. The rate of increase was such that it was doubling every 2 weeks, but it's very important for people to know that that has now slowed. It's now increasing at a far slower rate than that. So the prediction I made on your program about a month ago that this would peak out in the next couple of months and plateau, that still seems to be the case. And of course, this is feeding through into more deaths. But the problem, the one concern I have about those death figures, it's not only that they are, deaths with COVID rather than due to COVID. It's also that by testing many, many more people, we artificially inflate those death statistics. So, very simple example: someone goes into hospital last spring with COVID and they die 2 weeks later. They would have been tested. They would have been recorded as a death statistic. The same would happen now. But back in the spring, if someone went in with a stroke into hospital and they died a couple of weeks later, they probably wouldn't have been tested. But now everyone goes anywhere near the health system is tested. And since we have a higher proportion of the population infected today, that person may well have been positive. So they now would have been recorded as a COVID death, where that wouldn't have happened back in the spring. So by testing many more people, we're artificially increasing the numbers of deaths.
And there is a concern that we are not seeing the sort of the number of deaths we would normally expect to see, say, from flu, other respiratory illnesses. Those are counted as COVID deaths now. They're not merging the numbers together. There was a suspicion that was what they were going to do when they started putting that data together. But they're not merging that data together. But we are just seeing an awful lot of other deaths that we would normally expect at this time of year that simply aren't happening.
Yes, and it's not just flu deaths, it's any form of death through respiratory illness, COPD, and all the other forms of respiratory illness. They have dropped about 20% at least.
Where have they gone?
What we'd normally expect. Well, that's a good question. So I think there's two factors going on there possibly. One is what I just explained about the person with a stroke. It may be the same phenomenon there, that they could be positive for flu. They could also be positive for COVID and are recorded as a COVID death, whereas they would have been recorded previously as a flu death. So there's that going. Sorry, I've lost my track of thought.
No, don't worry. No, it's just I'm just saying, where have all those deaths gone? Where in terms of, you're saying that it may well be the same, that they're just not. We're testing more people and we're putting them down as deaths with COVID.
The other factor is it's also very clear that the social distancing, the lockdown we've done over the last many months has reduced the level of the flu virus. It's gone down dramatically. Not just flu virus, all infectious agents have reduced, and it was a very dramatic fall that happened back in the spring.
But of course, at the same time, we are seeing excess deaths, something like 25,000 excess deaths unaccounted for in people's homes, largely, we're thinking heart disease, people not getting treated for cancer, lots of other problems. So again, when we talk about death toll, I mean, people are talking about, isn't it awful, 367 people dying with COVID reported, 25,000 people dying at home, pretty much unaccounted for. No one seems to be worried about those people.
Well, some people are worried about that. I certainly am, and I gather you are. Yeah, I mean, these are the consequences of lockdown, and that's the problem. There is no good solution in the situation we're in. We will have economic damage. We will have excess deaths through lockdown. We will have death through COVID. The trick is to balance all of that and not keep focusing on trying to reduce and eliminate the COVID deaths at the expense of all other considerations.
Well, let's take into account the Imperial College research that was published yesterday. I mean, it's been all over all the papers. Sky News, BBC published infinitum saying, look, herd immunity won't happen. Basically, 95% plus of us won't have antibodies, even if you do get the virus and you have antibodies. And again, not everybody who's had the virus. I know people who've actually been tested positive for the virus when they've had it, and then a couple of months later don't have antibodies. They're saying you're simply not going to keep your immunity. Herd immunity, therefore, is not a route we can try to go down as a way of dealing with the virus. We're going to have to wait for a vaccine. We just had an eminent professor from Imperial College talking about this, who declined for whatever reasons to address any of my issues about T-cell immunity, which many eminent experts in his field say is actually, large proportion of the country will just have T-cell immunity to coronavirus, various coronaviruses anyway. But also the idea that actually, we look at countries like Sweden. Well, they are seeing 2 deaths a day. An average death rate from coronavirus at the moment is 2 deaths a day, and they're not in the sort of measures we're in. How could we account for that in any way other than some form of herd immunity?
Yeah, so absolutely. So let me just first comment on Paul Elliott's interview with you. Full credit to Paul for the work they've done in this study. So I'm very impressed with it on many levels. But I would just point out so this is directly reading from their paper, something that Paul Elliott and those put in that paper. Let me quote this 2 sentences to you. It is currently not clear what contribution T-cell immunity and T-cell memory responses will play in protective immunity during re-exposure. As such, it is not possible to say with certainty that the loss of antibody positivity would correlate with an increased risk of an individual being reinfected. So that's
it's interesting. He chose not to give me that answer, even though it's in the paper that he himself authored.
Yeah. Yeah, and so that's the problem. I think. Well,
hold on a minute. No. What is the problem? Why aren't eminent scientists? I mean, he knows his stuff. I don't know my stuff. I don't pretend to. I mean, I haven't even got a biology O level, for goodness' sake. I don't pretend to. But I can listen and read about, and read graphs and statistics and see what other eminent people who do know what they're doing. Why would he not make that point to me? What Why are people so intent on
Well,
telling us that that we're all going to die, basically?
This is a great question. And different versions of that question are so fundamental to understanding our reaction to this virus. Why is everything exaggerated, overinterpreted? Why is fear promoted in the way it is? Why can't we look at things in a more balanced way? And I think it's just a sort of groupthink hysteria that's going on at the moment and has been for some time. And I think a lot of the researchers looking at these data, they're so tied up with it. They're working, night and day. And it's perhaps sometimes hard to step out from that and to look at what we know about other coronaviruses, to look at what we know about SARS-1 from 17 years ago, to look at the whole picture and try to integrate all of those different threads into predicting what's likely to happen going forward. They're focused so much on the fact that the virus is increasing, people are dying, and that's bad. And so we need to address that and stop that now. All these other considerations could be taken to say, oh, we don't need to worry so much. And that
doesn't mean let it rip, and it doesn't mean don't take necessary precautions. We're all doing that. It just means get things in perspective.
Exactly. So the two extremes are lockdown or let it rip.
Yeah.
The middle road, it's called the middle path by the WHO. They've recommended that we take a middle path, which includes, by the way, a very explicit statement to protect those most at risk. That middle path is, I'm glad to say, what Boris Johnson seems to be trying to achieve against all the different political pressures he's under. So my hope is that we keep trying to maintain a middle path, which many might not like me saying this, but is a form of focused protection. Okay. We are letting the youngsters go back to school and university while continuing to protect the old.
Professor Anthony Brookes, I so appreciate you joining us, talking an awful lot of sense. That was extraordinary, that quote from the Imperial College paper. He's a geneticist and health data scientist at the University of Leicester.